Assalamualaikum warahmatullahi wabarakatuh. We are from EAP Group and will explain about diabetes.
What is diabetes? Diabetes mellitus is a group of metabolic disease characterized by high blood sugar level or glucose that result from defect in insulin secretion or action or both.
Types of diabetes. Type 1. Diabetes is a chronic autoimmune disease that occurs when the body does not produce insulin at all. Type 1 diabetes is most likely caused by the body immune system, which is supposed to fight pathogens mistakenly so that it attacks insulin-producing cell in the pancreas or autoimmune. Errors in the immune system can be influenced by genetic factor and exposure to virus in the environment. Type 2. Type 2 diabetes is usually more likely to occur in adults and the elderly due to unhealthy lifestyle factor, such as inactivity and being overweight. An unhealthy lifestyle causes the body cells to become immune or less sensitive to the hormone insulin. This condition is also known as insulin resistance. As a result, the body cells cannot process glucose in the blood into energy and glucose eventually accumulates in the blood. To overcome the symptom of type 2 diabetes, patients need to live healthier diabetes lifestyles, such as adjusting their diet and increase physical activity. In type 3 diabetes is a condition caused by lack of insulin supply to the brain. The lack of insulin levels in the brain can reduce the work and regeneration of brain cells, triggering the occurrence of Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease or a decrease in brain function that occurs slowly due to a decrease in the number of healthy brain cells. Damage to brain cells in the characterized by disease in the ability to think and remember. And then gestational diabetes. Gestational diabetes is a type of diabetes that occurs in pregnant women. This type of diabetes that occurs during pregnancy can affect pregnant women, even if they do not have a history of diabetes. According to the American Pregnancy Associations, this classification of diabetes arises because the placenta of pregnant women will continue to produce a special hormone. Well, this hormone is what inhibits insulin from working effectively. As a result, your blood sugar level become unstable during pregnancy.
Okay, next I will explain about the causes of the four types of diabetes. The first is type 1 diabetes. Type 1 diabetes is most likely caused by the body's immune system, which is supposed to fight pathogens or seeds of disease. Instead, mistakenly so that it attacks insulin producing cells in the pancreas or autoimmune. Mistake in the immune system can be influenced by genetic factors and exposure to viruses in the environment. Therefore, people who have a family history of this type of diabetes are at high risk of developing this disease. The second is type 2 diabetes. Type 2 diabetes is usually more likely to occur in adults and the elderly due to unhealthy lifestyle factors such as lack of movement and being overweight. An unhealthy lifestyle causes the body cell to become immune or less sensitive to the hormone insulin. This condition is also known as insulin resistance. As a result, the body cell cannot process glucose in the blood into energy and glucose eventually accumulates in the blood. The third is type 3 diabetes. Type 3 diabetes is a condition caused by a lack of insulin supply to the brain. The lack of insulin levels in the brain can reduce the work and regeneration of brain cells, triggering the occurrence of Alzheimer's disease. The fourth is gestational diabetes. According to the American Pregnancy Association, this classification of diabetes arises because the placenta of pregnant woman will continue to produce a special hormone. This hormone inhibits insulin from working effectively. As a result, blood sugar levels become unstable during pregnancy.
Some symptoms of diabetes. One, frequent urination. This symptom is getting stronger indication diabetes if it occurs at night, even to the point of making you often wake up in the middle of the night to go to the toilet. Two, very easy to thirsty. This actually still has something to do with the symptoms of frequent urination. You feel always thirsty because your body needs more fluid intake to replace washed urine. Three, feel hungry fast. People with diabetes have problems with insulin production or the body ability to respond insulin. As a result, the process of changing glucose into HEPAR. Your energy needs are not being met even after eating. The body that feels has not received energy will send a signal to return to eating. 4. Drastic weight loss. The body will continue to try to break down fat and muscle for energy. Well, the breakdown of muscle and fat is what makes you lose weight and makes diabetes thin. 5. Dry skin. This condition causes your body lose a lot of fluid through urine. As a result, the skin lost its natural moisturize.
Treatment of diabetes. Diabetic patients are required to adjust their diet by increasing the consumption of fruits, vegetables, protein from grains, and foods low in calories and fat. Food choices for diabetics should also really be considered. If necessary, diabetic patients can also replace sugar intake with a sweetener that is safer for diabetics sorbitol. Diabetic patients and their family can consult nutrition and diet with a doctor or nutritionist to regulate their daily diet. To help convert blood sugar into energy and increase the sensitivity of cells to insulin, diabetic patients are recommended to exercise regularly, at least 10 until 30 minutes every day. Patients can consult a doctor to choose the appropriate sport and physical activity. In type 1 diabetes, the patient will need insulin therapy to regulate daily blood sugar. In addition, some type 2 diabetes patients are also advised to undergo insulin therapy to regulate blood sugar. The additional insulin will be given by injection, not in the form of oral medication. The doctor will set the type and dose of insulin used, as well as tell how to inject it. In patients with type 2 diabetes, doctors will prescribe drugs, one of which is metformin, an oral medication that works to reduce glucose production from the liver. Doctors can also accompany the above drug with supplements or vitamins to reduce the risk of complications.
Next, for diabetes prevention, 1. Applying a healthy diet. Limit your daily sugar intake to 40 grams or the equivalent of 9 teaspoons of sugar. Instead, increase the consumption of vegetables, fruit, nuts, and whole grains that contains lots of fiber and complex carbohydrates. And 2, doing exercise regularly. Take your time to exercise at least 30 minutes a day. Any type of exercise, as long as it is done regularly, can be an effective way to prevent diabetes. 3. Maintain ideal body weight. 4. Manage stress. And 5. Checking blood sugar regularly. Thank you.
Maybe that's enough from us. We hope that what we explain can even be very useful. Thank you.